To reduce the burden of malnutrition in the FCT, the International Society of Media and Public Health is training vulnerable women with life-saving skills to enhance their living standard. Lois Abasambo reports.
UNICEF reports that about 2 million children in Nigeria are suffering from severe acute malnutrition, with 32% of under 5 children said to be stunted. 45% of under 5 deaths are also attributed to severe acute malnutrition, with only 2% having access to treatment. Yemi Jewel is a mother of 4. Her last child was diagnosed with malnutrition. Diagnosed with a health condition, Yemi is unable to feed her baby with breast milk.
I have problem for my breast problem. Since I born, I hold my pikin only 1 month, so the breast started to pain me, two breasts. So I couldn't feel give the pikin the breast, two breast didn't bring water again. I was using milk for her. So anytime if the milk finish, if you are not going to get money to buy the milk, you see him body be one kind. So I come that time, if I have problem, I said that I will not feel buy the milk. I come to use that I come small they give her. And sometimes if I give her that I come, sometimes it used to purge.
Poverty amplifies the risk of malnutrition. With a low income level, families are barely able to feed daily, much less get a balanced diet to meet their nutritional needs.
I've noticed that one of the problems, causing malnutrition is poverty. Most of them do not have means to solve or to take care of their nutritional needs.
The International Society of Media in Public Health, funded by the European Union Agent for Citizen-Driven Transformation Project, is training women like Yemi with life-saving skills to equip them and help them fend for themselves and their children.
So we decided that, look, we were going to train women, poorest of the poorest, and women who have their children are malnourished, to be able to have these life-saving skills.
The matron and chief nursing officer of Buhari General Hospital, Mrs. Amike Jang, who was also one of the trainers, noted that with local food products around, mothers can prepare healthy meals for their children.
If we want to bring our children out of malnutrition, out of all this kwashiorkor, we should learn how to prepare our resources available around us. Instead of saying no money, no money. If you come to the hospital, they use the money in buying blood always. Malnutrition leads to anemia.
These women are trained to make charcoal briquettes and liquid fertilizer, which could be sold or used for their farmlands.
We're going to provide them with a machine that will be used to produce this organic fertilizer. After the training, they will use the machine to practice as they had been trained, and then after the training, the machine will be left with them, and that is what they will be using to produce these items.
This will help them. Even their children will also benefit, because after producing this product and it has been marketing, the income that they will have, it will help them to sponsor their children to school.
With these new skills learned, the women are excited to go out and put into practice all they have learned and make a decent living.
Some of our children are malnourished because of lack of 1 or 2 diets. So they are helping us to teach them on how to use what we are farming, because we are farming a lot of things, but we don't know how to use them. I'm very happy about it, because if I have that, even that business, hold it in my hand, it will help me, because even now when you see me to do farm work, sometimes you see me like this, they will still say like, na better person, no be better person, because sometimes as I have the problem for the breast, if I'm doing work, even raw banana to carry on for my head, if I raise up my hand like this, it used to bring problem for me. So if I happen to get all that thing, it will help me.
The nutritional status of individuals greatly affects their productivity, and malnutrition reduces the economic potential of any country. Lois Basambu, ASO Television News.